Across the day, we've been hearing a lot of safety processes and recommended safety practices along the way in our decontamination. So as a last bit, I will be discussing a medical device management, which is the core of what we do in SSD. So, so the title of my theme, Medical Device Management, Ensuring Safe and Efficient Delivery to Reduce the Impact on Patient Care. A little bit of myself. Again, my name is Richard Sabino. I'm currently the Medical Device Coordinator of Central London Community Healthcare NHS Trust, mainly on contracts management and procurement of all medical devices in the community that we use. So under my remit, there are 17,000 individual medical devices across 300 static sites, plus patients' homes and GPs. So in terms of the contamination, I have nearly 22 decades of experience, from technicians to managerial up to the decontamination lead of the trust. So, and recently, a year ago, I was given an opportunity to work under the EBME to expand my experience. So going back to the presentation. So introduction. So patient care. So we always hear about patient safety all the time, about patient care. But patient safety is not the only factor about patient care. One of them is patient efficiency, on how soon we deliver the product of our safety processes to support the delivery of care to the patients. If we all have these safe processes and we end up with a product, but if it's the delivery of it to our service users is delayed, how can it help the ongoing numbers of waiting lists across NHS? So due to the aging and ever-growing population, it is not new to us that the waiting list figures is so high. According to NHS England, as of August 2024, more than 7.3 million waits for appointments and referral, and consisting of 6.24 million people waiting for treatment. And by the end of March 2024, for those who are lucky enough to get these treatments, more than 20,000 of them operations were canceled in the last minute due to non-clinical reasons, and one of them is through our medical devices. With activities and demands ramped up, we are pressured, and we know, given on those lists, are the challenges that we always have every single day in our decontamination departments. The pressured environment, because the list has to go down, the availability of instruments or the inventory issues or concerns, the timeliness of supply, the clear understanding of responsibility of managing medical devices. There's an inconsistency, and I would highlight this one, that this is a major factor of the delay of delivering this service. Procurement challenges, which is not new to us, and repair or how quick the repair and replacement of medical devices when they are out of use is also a factor, and a lot more. And a lot more is, I'm talking about navigating the complexities of the modern age healthcare decontamination. There is the viruses that have been evolving so strongly. There are AI, they are technology that we have to encounter, and that adds up to our challenges in our everyday process. Despite the ever-increasing challenges and the efforts of navigating these complexities of the modern age healthcare, it is important for every healthcare organization ensure a safe and efficient delivery of medical devices to reduce impact to patient care. And I will discuss and I will highlight, this is not all of the medical device management, but I believe that these are the 4 cores of what I need to tell you about. One is management responsibility, asset management, logistics management, and business continuity plan. Management responsibility, as you know, every managers, they all have responsibilities to the staff. So one of them, I'll just superficially tackle some of this, but there's a lot more to this. But what I think important is, one, policies exists, which is in line in the regulatory or applicable regulations that we have. For example, ISO 13485, it details every single ask of what do we need to have, or processes that we need to have, the records what we need to have in our departments to evidence that we are we have a quality management, quality medical device management. Trainings are available. One is internal. It is not new to SSD department that most of the trainings are in-house. And then an external. Support in any level is available from the management, and risk assessments are performed not only to selective processes, but to whole processes. To staff, to the materials you use, to the procedures you do. They should all be validated, and it should work within your department. So, another management responsibility is to ensure that all staff are confident enough to report any incidents. And that's a part of the vigilance. So at the moment, in my experience, when technicians are having an issue, when you ask them to raise a DATIX, which I'm sure you are all, I hope you're all about DATIX, is that, oh, I don't know how to use that. It will go to the supervisor or to the manager. But I believe that everyone have a fair share of reporting incidents because it reduced the delay and sending this across to MHRA. Then obviously, with these incidents, is an effective CAPA that are put in place in full promptness and learning are communicated. So most of the time in our department, you will see, oh, it's ongoing. The action is ongoing. But you have to divide the actions. There's a short-term action and a long-term action. One short-term action, what are we doing now to prevent that? And what are we, and the long-term action, and how would we prevent this from happening again? Those are two types of CAPAs. So some example I mentioned before is DATIX and yellow card. Another one is competence management, that all staff are trained and up-to-date certification. I think it's been mentioned earlier about the new technical bulletin from NHS Estates responding to HSSIB report asking them to have a competency framework within the contamination department. So take this advantage. We will take this advantage to support our staff to have that certificated trainings. In my experience, most of the time, trainings are hand-me-down. But it reduces the consistency of that training. It reduces the uniformity of that training. But if you have a certificated trainings, and there's a lot out there, then at least you can evidence that everyone who holds that certificate have received a consistent and uniform trainings where you can apply back to your departments. And I'm sure this will be a big support now to all managers to ask for funding for all staff. But there again, I'm not saying that this is all about management responsibility. Even staff, all staff have to invest more, or initiatively invest more to improve their craft. We cannot only base it or depend on what the managers can give us or the department can give us, but if you want to, if you care about your job and if you care about if you understand what you're doing about patient care, please invest it. Please invest some time on your own to improve your craft. Okay? And then obviously communication. So communication, obviously any reports, updates, changes are regularly reported across the group and all relevant stakeholders. And that's easy to say. All right, so the manager, can you please talk to the deputy lead? The deputy lead talk to the supervisor. Supervisors talk to the technicians. But the manager, for me as a manager, I always say, how did you record that? How can I guarantee that this message has been sent down across, not only verbally, but in a written evidence? I do believe that anything that is not written didn't happen. And for you staff as well, you can use this and you have the right to demand, can I have a record of that? So if something happens, then you've been trained. All right? Now, all right, so the next one is asset management. So procurement records are maintained always. Shelf life awareness of every single medical device is important, not only it will last until it breaks. It doesn't work like that. Every single technical file of every single device has a shelf life. I don't know which department here always record their shelf life and review them regularly. IFU documents are available for, and then this is one thing to highlight, especially on loan instruments, IFUs. You might receive IFUs that are compatible for US markets. You will accept that most of the time. But since inexperience, day-to-day, we use this, we just assume that thing. But no, IFUs regularly change. So make sure that your account manager, in terms of your IFU, has given the declaration that the processes is compatible to the UK standards. Yep. You might see other as well from EU that they will ask you minimum of 3 or 4 minutes of sterilization, but it doesn't work for us like that. If something happens, did we meet the 4? At the end of the day, legally, it will all go down to the IFUs. So again, PPM repair. So your periodic private maintenance history records are kept. It is very, very important that, because most of the time we use companies that don't meet the standards the same as us. Now, procurement management. All new instruments required will undergo safe and proper product selection process. So normally it is not new to you that you have this pre-acquisition form that they normally fill out and make sure and ask questions that everything is, do they have the certificates, do they have the UK CA market, do they have the MDR certification and all of that. So we all have to go through that process. Then ensure as well that what we are buying is compatible to the decontamination processes of the outsourcing company and our organization. So risk assessment, as I mentioned before, and proper storage is available. HBN 13 is a guideline for SSD of what temperatures they have to be served. So you can use HBN 13 as your reference. Then track and trace. All instruments are accurately accounted for. That's very, very important for us in a community setting. 17,000, and they are they are mobile every single day across home patients, everything. How do we track that? How do we ensure that they are still there active? Because it not only saves you financially, it also gives you the confidence that what you are using are safe. Patient-to-instrument traceability records are maintained. If it's possible within your organizations like Scan for Safety and everything like that, it is very, very important to integrate both clinical and your department. Then obviously, it has to be robust process. If you can have a software that can go to the granular level of tracking and tracing things, please do go that. They might be a bit expensive, but it's worth the spend. And then, obviously, not only us, ensuring clinical staff are trained on how to use instruments properly. I think this is a challenge as well. And then they are aware of the decontamination protocols as well. Then logistics management. Schedule of collection and delivery are based on the demands of the organization. That is very, very important. So have a meeting with the service users and ask what they need and how do you apply that to your thing. Ensure that services provided by logistics provider meet Transport of Dangerous Goods Act. We can't just call any delivery companies, oh, can you please move this and move that. So make sure that they do have the standards and the drivers as well are properly trained on specific standards. Outsource service management. Ensure that service meets the demands of the trust. Again, everything is within the needs of the organization. And then ensure the company is committed to maintain their certification, not only for 134, and meets the medical device regulation. So, and then whoever you are contracting services with, you have to ensure that they will sign a contract, that they will treat the assets as well as like how we treat them. Then to ensure that regular reports are evident to me, so obviously there will be a KPI as well. So this is very, very important because this is the report that goes to directorial. So, and this is the numbers that don't lie. And this is the numbers that will reflect how we did as an organization or how we did as a department in periodic stages. So, and then we action them, we action the unsatisfactory ones as well of any given KPI. So we have to be strict. If we are demanding from contracted services as well, we have to stick on what we expect. Sometimes emotions comes in the contract management. But again, if something goes wrong, it will all go down to the paper of the terms. Then the most important thing is the business continuity plan. So to have an efficient service or in delivering patient care, you don't want the services to be interrupted at all. So always ensure that your organization in every single processes should have a BCP. So there is a departmental BCP when the problem is within your department, like backup instruments, reliable relationship, for example, loan instruments where you can have relationships to your account managers if they have instruments in the other hospitals that can help you. And then you have organizational BCP when the problem is a big role, like there's an issue with estates. So in-house soft and hard FM support. Then obviously, the BCP should be managed, regularly reviewed, and active all the time. So all of those that I have mentioned will result to this. This side, unsafe processes, and this one is being efficient. Conclusion, as a healthcare organization, all of us have a responsibility. And the Health of Social Care Act, as Regulations 15, that states that our medical devices should be safe for patients' use. And medical device management, there's a lot of ways to do that. But it has to work within your department. Thank you.